Hello everyone, welcome to my channel. I am Kavya. Today I am going to talk about shoulder joint complex. It includes introduction, various joint it consists, and the movement it permits. Shoulder joint. It is the joint of upper limb which connects the upper extremity with torso. It is a complex joint that comprises of 3 anatomical and 2 physiological joints. Number 1, Gleno-humeral Joint. Number 2, Acromio-clavicular Joint. Number 3, Sterno-clavicular Joint. Number 4, Coraco-humeral Joint. Number 5, Scapulo-thoracic Joint. So let's talk about first, that is Scapulo-thoracic Joint. It is also called pseudo joint. Pseudo means false, as it is not present anatomically. As the name suggests, this joint is present between scapula and thorax. Now, the position of scapula. It is present around 3 to 4 cm from midline and inclined at an angle of 30 to 35 degrees from the frontal or coronal plane and tilted anteriorly at 10 to 20 degrees from vertical. The main muscles that leads to the movement of scapula are trapezius and serratus anterior. Now we will talk about the movement it permits. There are 4 movements: protraction, retraction, abduction and adduction. In protraction, the scapula moves away from vertical column. In retraction, the scapula moves towards vertical column. In abduction, protraction and lateral rotation happen simultaneously. In abduction, retraction and medial rotation happen simultaneously. So let's talk about the rotation of scapula. It can be either described on the context of inferior angle or glenoid cavity of scapula. When inferior angle moves away from vertical column and glenoid cavity moves upward, then it leads to lateral rotation. Second, when inferior angle moves towards vertical column and glenoid cavity moves downward, then it leads to medial rotation. Second is Sterno-clavicular Joint. It is an anatomical joint formed between sternal end of clavicle with clavicular notch of sternum. It is of saddle type synovial joint which connects the appendicular skeleton of upper limb with axial skeleton of the trunk. It has a fibrocartilaginous disc which is attached to the manubrium of sternum between articular surfaces. Now, let's talk about the ligaments that stabilizes this joint. First, anterior and posterior sterno-clavicular joint. As the name suggests, they are present anteriorly and posteriorly. Second, costo-clavicular ligament. As the name suggests, costo means cartilage, clavicular means clavicle. So, it attaches the cartilage with the clavicle. Third, interclavicular ligament. It is present between the 2 clavicle. Now, the movement this joint permits: elevation, depression, protraction, retraction and axial rotation. Third is Acromio-clavicular Joint. It is an anatomical joint of plain synovial type. It formed between acromion process of scapula and acromial end of clavicle, also known as lateral end. The primary function of AC or Acromio-clavicular Joint is it provides additional range of movement of scapula and also provides stability. Ligaments are superior and inferior acromio-clavicular ligaments. They are present superiorly and inferiorly. Second, Coraco-clavicular ligament. Though it is not a part of AC joint, but it is responsible for this stability because it unites clavicle with scapula and also prevents rotation of scapula at AC joint. Fourth is Gleno-humeral Joint. It is a true anatomical joint of ball and socket type. It is formed between glenoid cavity of scapula and head of the humerus. the axis of head and the shaft of humerus form an angle called angle of inclination of humerus, and it is around 130 degree to 150 degree. It also allows 3 degree of freedom, that is 3 angular and 3 translatory. In transverse plane, the axis through which humeral head and humeral condyle form an angle, it is called angle of torsion. Normally, this angle is around 30 degree, but if increases, then it is anteversion, and if decreases, then it is retroversion. Stability structures. These are the structures that stabilizes this joint. First, glenoid labrum. Articular surface of glenoid cavity or fossa is very shallow and prone to dislocate. Labrum is a fibrocartilaginous structure which is attached to the rim and lead to deepening of fossa and thus provide stability. Second, gleno-humeral capsule. It is fibrocartilaginous structure which is taut superiorly and loose inferiorly. This capsule allows 1 inch of distraction of humeral head in loose pack position. Third, ligaments. Superior and inferior gleno-humeral ligaments. They are present superiorly and inferiorly. Middle gleno-humeral ligament, that is present in the middle. Coraco-humeral ligament, that is present between the coracoid process of scapula and humeral head. Transverse humeral ligament, that is present in a transverse direction on the head of the humerus. Fourth, bursa. Subacromial bursa, subdeltoid bursa, submuscular bursa. Mobility structures or dynamic structures. Muscles are responsible for any movement in and around the joint. Important muscles are rotator cuff muscles. It includes supraspinatus, infraspinatus, teres minor and subscapularis. Other than RC group is deltoid and long head of biceps. Last but not the least, Coraco-humeral joint. It is a physiological joint present between coracoid process of scapula and head of the humerus. It is present in a form of an arc which is made up of osteoligamentous structure. The subacromial bursa lies in this region. This arc provides a passage for rotator cuff muscles and prevent from direct injury. Movement of shoulder joint complex. It permits flexion, extension, hyperextension, abduction, adduction, horizontal adduction and rotations. Flexion from 0 to 180 degree, extension from 180 degree to 0, hyperextension from 0 to 60 degree, abduction from 0 to 180 degree, adduction from 180 degree to 0, horizontal adduction from 0 to 45 degree, rotations both internal and external from 0 to 90 degree. Thank you.